So now that the cement has been on there for a few minutes, you're going to check the consistency of it to make sure that it's not too hard or too soft yet. If we had zinc phosphate cement, you would want it to be pretty hard or brittle, okay? And which means it could not be indented with your instrument, okay? This is polycarboxylate, and we want that to be kind of rubbery. So we would want to be able to, make an indentation in it, and then it would kind of pop back. With the glass ionomer, it within about 3 minutes, it reaches kind of a waxy looking stage. Kind of like if you looked at a piece of boxing wax or utility wax, it would have a little bit of a kind of a different shine or surface to it, okay? All right, so now once your cement is at the proper consistency, then you would go ahead and ask an instructor to start your time, okay? Now this is the actual expanded function. It's the removal of the excess cement that's squished out or squeezed out around the gum line when we cement a crown, okay? So you would get a start time, and you would go ahead and start removing it. Now, there's different things that you want to, as far as technique, and there are different instruments that we could use to remove excess cement. You can use a scaler, like a U15 scaler, which is one that we have available at all times here in the clinic. You could use an excavator. It could be a Black's spoon excavator, or could it just be an excavator, or like a little regular spoon excavator, or you could use an Explorer. I like to use the Explorer when I check for residual cement that's kind of under the gum line. It's a lot nicer to use an Explorer than it would be to use a scaler, because the scaler has the two cutting edges. And that's always a little scary, I think, to go under the gum line with a scaler, okay? So the first thing we're going to do is we want to remember that when we're removing cement, we do remove it with a horizontal stroke, this direction, okay? Lateral or side to side, going from mesial to distal. We don't want to be using a stroke that goes with the long axis of the crown, because now we're actually kind of pulling down, maybe even on that margin of the crown, and we could maybe be pulling it loose a little bit, okay? So always this way, all right? It's a very good idea to take a little bit of gauze, piece of gauze, and hold it underneath so that when you remove the cement, that it doesn't fall into the patient's mouth. It's also a good idea to have a saliva ejector that is going to be placed. So if there was, to pick up the saliva, but also if there was a piece that fell down, you could just hopefully kind of go down and it would aspirate it up. Okay, first thing we're going to do then is we're going to use I'm going to use the U15, and you always want to use the side of the U15 and not the tip, okay? Never the point. Although you could use the tip or the point just to go in and loosen up your area in the inner proximal, okay? And you can kind of see it lifting, and that's exactly what it would do on a real patient, okay? Now, because these Typodon teeth, they're not porous, like enamel, the cement just kind of pops right off. But know that in a real life situation on a tooth, you might have a bigger piece or two, little chunks that do pop off in a fairly good size. And that's fine, just make sure you catch it so it doesn't go into the patient's throat. And then you can come back and, remove the rest of the residual little pieces, okay? So I'm just going to move, and you can see how this is pulling away in one big piece. On a patient, it probably won't do that quite as well. But so you would just go ahead and remove that. And well, it's not the most realistic situation, but you would just remove it like that, and it would pop off into your gauze, or maybe fly out on the patient's napkin, which sometimes does happen. Okay, Well, now it almost looks like we have absolutely no cement there, but we're gonna pretend like there are some little pieces, okay? We would do the same thing with the lingual, and you wanna hold it similar to this, okay? So I'm holding the mirror, I can still see on the lingual, but I'm also holding the gauze underneath it so I can hopefully catch little pieces or bigger pieces of cement before they fall into the oral cavity, okay? So probably the best place to start would be the interproximal areas and get that out of there. And a lot of times when you loosen it up in the interproximals, it kind of loosens it up all over, okay? All right, so now we're just gonna say that we've removed the majority of it. And now I'm going to look into the sulcus area. And I'm going to use that with my air syringe and just blowing a little bit of air, not a real big stream, but just a real soft stream of air that's going to deflect the gingiva away from the tooth so I can see if there are any little pieces down underneath the gingiva, okay? So just like that. Sometimes, I don't know if you saw that little piece that just flew out. Sometimes it's a matter of just blowing a little air and it blows it right out. You do that on the facial and the lingual. Okay? But sometimes you can actually see a little piece in your mirror, and then you would just go back up there with an Explorer, okay? Not the U15. And you can just go just like this. Just kind of go up like so. You can kind of look in your mirror, okay? And just like so. Sometimes you can go, if you hold your instrument like this, be careful that you're not going up too far, all right? It's probably safer to go with your instrument like so, even though we're not supposed to use the tip of instruments. For this, it might be a little bit better choice just so that we don't jab up into the bottom of the sulcus area, okay? Okay, and I don't see any there. The last thing, or you could do the flossing first if you wanted to. So it doesn't really matter. You know, maybe using the floss first might be a little bit better choice. It's up to you, okay, as long as you do both. I've put a little knot in my floss, okay, and I actually did a double knot, okay? So when I actually go down in between, I'm gonna zigzag it down in between the crown, and then I don't wanna necessarily go up and down like this because, again, this is a vertical motion. We probably just wanna go, you know, see if we can find any, you can kind of zigzag it, but also then you could pull it through like, whoops, we have a little bit more of a diastema here in between the teeth than a patient would probably have, but that little knot would many times, you know, catch a little piece that's under the gum line or in the interproximals, and then you just pull it out like so, okay? Be careful when you're pulling floss through that you're not pulling it through the gingiva like this and end up cutting the gingiva with the floss. You want to come in or come out more like so, okay? So you're bringing that floss through and then coming out like so. So you're kind of pulling away from the gingiva, okay? And you could repeat that a few times and then go back in with your air and again, do a final check, just like so. Okay, and that looks good. So when you're all done, then you would ask the instructor for a stop time, okay? And then we would come over and check the areas. And so be aware of what those numbers are. You are allowed 20 minutes to remove cement here in school. In real practice, it's about 5 minutes, okay? So in school, you're allowed 20 minutes, but you still might lose points, okay? And that is shared with you on your step-by-step evaluation. And then, of course, I would rather if you took a little bit more time to do something accurately so you don't have little pieces of cement, as opposed to getting points off because of having the cement, just like with polishing. I'd rather have you, if you're going to lose any points, I'd rather have you lose points on going over time a little bit than I would just have to take off points because there's plaque left. Okay, so again, yes, we want you to become quicker and more efficient, but we also want you to do a very thorough job at whatever procedure that you're doing. And that is it for removal of excess cement.